we all collaborate in many aspects. This is a side event that puts forward the role of the civil society, of the organized civil society, and I want to express the support that we have from our delegation, and in fact from the ministry and from the government of Spain, to the role of the civil society and its involvement in the field of action on the problems posed by drugs. And here in Spain, we just approved the National Action Plan on Addictions for the period until 2024, which has been approved by unanimous consensus. And it's been the fruit of a very large consulting process, which has involved also civil society. We have an advisory council where civil society is represented, as well as governmental bodies. And the work that has been done has made possible that in this time where political consensus is so hard to reach, we have approved this new action plan on addictions by unanimous consensus. Let me express also the relevance of the organization Proyecto Hombre. Proyecto Hombre, which has a key role in this side event. It's an organization that in our country and internationally has a very important role, develops very valuable programs and services, and also in the field of training. In Spain, it offers a master's program in the field of drugs that we are very happy to collaborate with. Now, on this side event, the focus is put on evidence-based action. And I want to emphasize this factor because we do have many efforts that are based on goodwill, but not always are evidence-based. And we need to be very solidly based on science and evidence in the efforts we put forward. Now we need to foster this in all the fields, in treatment, in prevention, in regulation, everywhere. There have been some very important advances. The standards project, the international standards for the treatment of drug use disorders that the United Nations Office of Drugs and Crime has been developing is, I think, a very valuable contribution. In Europe, the European Monitoring Center for Drug and Drug Abuse has developed the Exchange project that helps us locate evidence-based action to inspire action by everybody. And in Spain, we have been developing an evidence-based portal to collect programs and services that have proven their value so that everybody who needs to advance can use them. And we'll probably be concentrating our support in the projects that are collected and have been able to provide this sort of evidence. And I think that's all. I don't want to extend this welcome very much more. I'm very glad to be here, part of this event. I'm very thankful for the opportunity to be here with you. And I want to emphasize the need that we all keep working together in collaborating with the participation of civil society. We hope that we will all learn from this event, and you will always have our support from the government delegation from National Brand of Drugs, the Ministry of Health, and the government of Spain. Thanks.
I thank you so much, Dr. Villalbé. Thanks for your continued support with us. Thank you so much. Thank you. Now we move to Giovanna Campello. You all probably know who Giovanna Campello is, so needless to say what that means for this side event to have her on board. She's the chief of the prevention, treatment, and rehabilitation sector of UNODC. Please, Joanna, you have the floor.
Can you hear me? I was getting strange messages from Zoom, but I'm glad they were not serious. And I'm sharing with you a couple of slides. Don't worry, I will not go on for a long time, because what I really want to say is just give you an idea of why, for us, the collaboration with civil society organization is absolutely key, and just give you 3 small examples of how without civil society organization, there is no way we are going to address the drug situation together and solve it and do so effectively. And in my view, let me see, there are 3 ways in which CSOs contribute in a way that few other kinds of organization can. And I've tried to find 3 ways, all that start with I. And the first one is innovation, innovating. Time and again, we have seen a civil society organization developing new evidence-based tools. And it's true, also university work in this field, and many governmental agencies have developed also innovative products. Maybe this is not a something that only CSOs do, but some CSOs do and do it very, very well. And so, for example, I know that you will hear some examples already. And for us, in this particular case, we have been very fortunate to partners with Lions Clubs International Foundation to they have themselves developed an evidence-based program for prevention in schools. And we've been very fortunate to partner with them and disseminate and implement evidence-based prevention in many countries in the world. And it's not, but I don't want to focus on our work. What I want to focus on about is that this work would not be possible had a CSO not taken the lead and develop this new tool. Another, I think, way in which the civil society sector is absolutely unique is integrating. And by integrating, what I mean is integrating people who use drugs, people with drug use disorder in the treatment and healthcare system where before they were not integrated, and basically filling the gaps in the provision of services of treatment, healthcare, social protection, recovery, and rehabilitation of people who use drugs and people with drug use disorder. Because too often, people who use drugs and people with drug use disorder may be hard to reach, too stigmatized, too poor. And if it was not for CSOs, these people would never enter into contact with the treatment and care system. And I would dare to say that at the beginning, the treatment and healthcare system was hardly anywhere to be seen in many, many countries. And it was the civil society organization that started to fill in this gap and to support this, our patients, as Gilberto used to say, people with who use drugs and people with drug use disorder, when nobody was doing anything. And the last way in which I think the civil society sector is absolutely unique is in involving affected populations. So not only reaching out to populations that are hard to reach or too stigmatized, but involve them in first person in a meaningful way in the development, implementation, and evaluations of policies and strategies, and basically giving people a voice, where a voice is very difficult to be heard in governmental institution, in policy-making institution. And I think that this is a contribution that the civil society sector is uniquely positioned and to do, and can do very, very effectively indeed. I'm sure there are many other ways in which civil society organizations contribute to addressing the world drug situation together. These are just the main ones that I've seen again and again and again in our work as amazing contribution of the civil society organization. And I know that you will hear more examples today, so I don't want to take more time, just to express the wish that this not only continues, but it can be expanded, and our partnership together can be expanded. Thank you very much.
Thank you to you, Giovanna, and to your team, to the whole team that you are leading. Thank you so much. Now it's turn to Matej Kosir from the civil society side. He is the deputy chair of the Vienna NGO Committee on Drugs. Let me take this opportunity also to congratulate him, because he's been this week re-elected as vice chair, deputy chair. So congratulations, Matej, the floor is yours.
Thank you very much. Can you open a video for me as well, because I cannot do it? The host have to open the video.
We are trying.
Oh, it's okay. I'm here. Okay,
Hi,
great.
Matej. How are you?
Fine, thank you. Greetings from Vienna. We are here to try to unshrink the space for civil society organizations again at CND. And thank you very much for invitation. We are very happy to support the event and participate as speakers or opening speakers. I will be very short to leave more time to other more important speakers of this event. And also I see many colleagues from civil society organizations also participating in this event. So I'm very happy to see the civil society engagement also in many side events during the CND, especially because civil society organizations are very often initiators or the key engines or advocates for evidence-based interventions in the field of drug demand reduction. Sometimes in some communities or some countries, there are the most important or maybe also the only advocates for evidence-based interventions. And also many of them participated and are still participating in many processes in different levels at international or national level in drafting or developing different international documents like international quality standards in prevention or treatment, also European quality standards. In all those processes, civil society organizations were really strongly and are strongly involved in the processes. So we constantly put a pressure also as a civil society on policy and decision makers to do better job regarding policies, funding, also increasing an evaluation culture, also disinvesting from ineffective or harmful interventions. So we are really important part of these processes and promoting evidence-based interventions and standards. And also, as speaking on behalf of Vienna NGO Committee, we organize and conduct many activities and inform and engage civil society organizations to be involved in these discussions on evidence-based interventions as well. And maybe speaking from my own perspective, I'm a representative of civil society organization from Slovenia, and I can also give you a good example. At CND tomorrow, the CND will vote or probably adopt the resolution submitted by Slovenia, France, Nigeria, and also supported by Pakistan on early prevention. And we, as a civil society organization, were actually initiators of this process. So it is also important from this political point of view that we are active We support policy and decision makers. We put the pressure so they do better job also in the political from the political point of view. So that would be all from my point of view, and happy to follow your event, and good luck with the event. And I see a lot of participants will surely enjoy the event. Thank you, Oriol, and other colleagues from Project Hombre for invitation.
It's a pleasure, Matei, and you mentioned a paramount example, the one supporting the resolution from Slovenia, but civil society was, as you said, initiating the process. Thank you so much. Now we move to the first good practice. It will be presented by two great experts on prevention, Arantxa Fernández from Association Proyecto Hombre, and also Susana LLAV as a professor from the University of Oviedo in Spain. So please, the floor is yours, both of you.
Thank you, Oriol, for your presentation, and thanks for the invitation to be here. So I will going to explain in a very briefly way the experience of Proyecto Hombre in the field of drug abuse prevention, and to present the school-based program Juego de Llaves. The Asociación Proyecto Hombre creates the National Commission on Drug Abuse Prevention in 1999 with the aim of structuring the work methodology in this field and to promote the design of prevention programs. At the moment, Proyecto Hombre has prevention programs aimed to the main context of action such as school, family, community, and work, and at the three established levels of preventive intervention: universal, selective, and indicated. Anna, can you please share the slides? Thank you. Next one, please. So, okay. As you can see in the slide, these programs are implemented through a network of 28 centers in 15 different Spanish regions in which more than 19 prevention professionals work. From the beginning to the present day, the prevention programs of Proyecto Hombre has reached more than 1,400,000 people, mostly through the school-based prevention programs. The work experience of Proyecto Hombre in the school environment began in the year 2000 with the task of designing a school prevention model. Next, please, Anna. Next slide. The result was the creation of the school-based prevention program Entre Todos, in English All Together, aimed at the secondary education. In Spain, this level covers young people from 12 to 16 years old. This program is based on the Spanish program Construyendo Salud from the University of Santiago de Compostela, which is a Spanish adaptation of the life skills training program developed by Botbin. After that, and in response to the demand to extend the program's coverage, the contexts for the two last grades of primary education were designed. In 2013, a process of revision and updating of this program was carried out. As a result of this review, Juego de Llaves program was born, in English, Set of Keys. It began to be implemented in 2014 and was evaluated in 2017 by the University of Córdoba. After learning the results of this evaluation, the program was improved, and at the moment, it covers the entire primary education, children from 6 to 11 years old, and secondary education, 12 to 16, as I said before. Juego de Llaves program is presented as a set of tools targeted at different groups, with the aim of promoting healthy lifestyles and preventing high-risk behaviors related to addictions. Anna, next slide, please. The program includes interventions aimed at students carried out by teachers in the classroom and at families carried out by the technical staff of Proyecto Hombre. It also includes teachers training, as well as supervision and guidance in order to facilitate the application of the program in the schools. In secondary education, the school component is developed in 6 modules. As you can see in the slide, these are emotional management, cognitive strategies, social interaction, leisure and free time, information about drugs and other addictive behaviors and values. And the family component consists of 11 sessions about topics related to the modules mentioned before. We are currently immersed in the process of evaluating the impact of this program in collaboration with the University of Oviedo. In this process, we have the technical collaboration of the United Nations Office on Drugs and Crime and the financial support of the Spanish government delegation for the National Plan on Drugs. My partner in this presentation, Susana Al-Halabi, lecturer in the Department of Psychology at the University of Oviedo and head of the research team, will describe this evaluation project in more detail below. Thank you.
Thanks, Arantxa. Susana's turn.
Hello, good afternoon, everyone.
Hello, Susana.
Thank you, Oriol. It's a pleasure for me to take part in this activity. I would like to thank the organizers for inviting me. So my presentation will be very brief. I just would like to outline some ideas without going into much detail. I would like to present a project that is a model for evaluating prevention programs in collaboration with civil organizations, which can be exported to other communities or countries. The aim is to provide the scientific and technical community with a working model that seeks to promote evidence-based interventions and scientific excellence with the support of renowned institutions such as United Nations Office on Drugs and Crime. And this project has received funding from the Spanish National on Drugs Plan. So this is our scientific team made up of professors and researchers from the Addictive Behavior Group of the University of Oviedo. For me, it's a great pleasure to work with them. So what we are facing here is to promote evidence-based data. In this regard, there is a gap in Spain in the field of prevention, as it's the evaluation of the results of drug use prevention programs. There is no information on the result of programs currently applied in schools. So it's crucial to have long-term evaluation of results via quality standards. Bearing this in mind, these are the aims of our project. As you can see, the main objective is to design an assessment protocol to analyze the impact of set of keys on drug use and other indicators of emotional well-being in the adolescents. Now, I will move on the design and assessment areas. The design is a non-randomized controlled trial by cluster with pre and post-test and follow-up at 3 and 6 months and 1, 2, and 3 years. This covers a total of 4 years with a sample of more than 2,000 students from different schools all over the country. Now, let's look very briefly to the assessment. The assessment, as you can see, covers 3 large groups of variables: general, proximal, and distal. The proximal and distal variables assess the main content of the program, such as there are no models without assessment and no variables which is not justified by the content of the program. This is the process in which we are now. We have designed a full evaluation battery, which is being converted into a digital application. Then, using tablets to help data collection, it will be applied to a pilot sample. Over the coming years, we will do the large-scale application. And we hope to publish the assessment protocol at the end of this year, so you can read it carefully and wherever you want. We hope to publish it soon. And that's all. Thank you very much for your attention.
Thank you to you, Susana, because this is a very promising and interesting evaluation. We really need it, so thank you so much. Then our next speaker is Lucia Goberna from one of the most relevant organizations worldwide, international, the ANOVA International. Lucia, the floor is yours.
Thank you very much, Oriol. I have the same problem with the video, so hopefully you can enable that at one point. But I will start speaking. I will share my screen. So thank you very much for the invitation. I'm really happy to be with you today with such a high level of panelists, and I would also like to acknowledge the welcoming remarks from Dr. Villalbi and Ms. Campello about the role of civil society organizations. This is very much welcome. So as Uriel said, I am representing the ANOVA. Just a few words about the organization. We have 22 members in 19 countries working on the social sanitary field, and we have a vast experience in the prevention and treatment of addictions. And today I would like to share with you a very concrete example of a collaboration of civil society with public authorities on a way to promote evidence-based interventions. And this takes place in Uruguay. So on the one hand, for the stakeholders, we have the National Drug Secretariat, that is the body in charge of developing strategies and operative guidelines. And also we have RENADRO, that is the drug treatment network of Uruguay, implementing those policies and practices. From the civil society, we have the ANOVA Uruguay that has been present in the country for over 28 years in the field of mental health and addictions, and that runs the dual pathology treatment center of Chanaes. Chanaes is based on a biopsychosocial approach, residential modality on medium to long term. And so back in 2017, the National Drug Secretariat decided to implement a quality standard system in drug demand reduction and took as a reference, as a guide, the standards developed by Coppolat that were published in 2014 on quality and evidence in drug demand reduction. And they did so because those standards were using the available knowledge from WHO and UNODC, and also taking into account the culture of quality, and also considering the real possibilities of implementation, because the standards had been validated for every country in Latin America. So they took this, the Coppolat standards, as well as ISO quality certification, ISO 9000. And in 2017, they established an evaluation and monitoring area team that had the aim, among other aspects, they started implementing a pilot to test the applicability of the indicators. So what they wanted to do is they took Coppolat's indicators and wanted to test in 3 different centers in Uruguay if those were valid. I mean, not as to test as if the centers were valid, but if the indicators were valid. And Chanaes was chosen as one of the centers to implement those. So the first contact started in 2017, when the ANOVA's team started systemizing programs, documents, and procedures ahead of the first visit of the National Drug Secretariat's visit to Chanaes, to validate the evaluation checklist that contained 83 criteria that were made of a range of different aspects, such as structural criteria on the rights of patients, or the organizational aspects, or human rights principles, for instance. Also to functional progress criteria, so regarding the accessibility or human resources, etc. So 83 in total, highlighted by Coppolat. And as a result of this audit, the National Drug Secretariat team, they issued a report with opportunities of improvement, what can be done in Chanaes for improving that were duly noted and addressed ahead of the second visit that took place in 2019. So this very concrete example is just to show up how this was a win-win situation, because from the public authority side, they validated the indicators, and so they could set up and implement the quality management system that has been implemented since 2018. but also from the side of the ANOVA Uruguay, it improved the program because we've implemented the opportunities of improvement that were signed up by the audit, but also it encouraged to implement the quality standard system within the organizations, and we're currently working on that. And just as a final note of this best practice, good practice, to say that collaboration is key to implement evidence-based intervention. In here, authorities were able to interpret if the intended interventions were feasible, necessary, appropriate, and replicable, and civil society organizations could improve their internal processes to thrive for better services. I also totally agree with what Ms. Campello identified as the 3 I's. So thank you very much for that. And just as a final remark, to say that a wider range of services that meet the therapeutic needs of users must be provided. And this can be enhanced by collaboration with civil society and public authorities, because we shouldn't lose sight that the end beneficiary of all these collaborations are the users of the services. So with that, I thank you very much for your attention.
Thanks to you, Lucia, for this amazing presentation, and very precise. And notice, everyone, that we've been selecting good practice on prevention, another one, Lucia's one, on treatment, and then the next one. Now we travel to Kyrgyzstan, and there's a very interesting harm reduction initiative. I introduce to you to Daniil Nikitin, the chairperson of Global Research Institute Foundation, GLORI. So please, Daniil, you have the floor.
Thank you, Rio.
You are waiting for the slides?
For the slides, yeah.
Yes. Here we are.
Okay. In my presentation today, I am going to tell about 2 community-based evidence-based efforts, both performed with active involvement of the communities of people who use drugs. These are the project on overdose prevention and self-testing for hepatitis C. Next, please. I would like to acknowledge my friends, colleagues, and partners in Kyrgyzstan, Kazakhstan, Tajikistan, Ukraine, Australia, and Switzerland, as well as donors at UNODC, WHO, International Network of People Who Use Drugs, and Foundation for Innovative New Diagnostics, for their generous input and sharing scientific and practical ideas that helped us very much. We are grateful to all project beneficiaries for their responsiveness and willingness to participate in the project. Next, please, sorry. In Kyrgyzstan, we were able to deconstruct the scientific method and reclaim role of people who use drugs in setting up the research agenda, and collect and analyze data that would in turn inform policy and result in greater benefits to people who use drugs, other vulnerable communities, and general population as well. We were able to ensure high quality results of community-led research while deconstructing and challenging the way research is traditionally conducted. The presentation focuses on concrete examples of how the community-led research improves people's well-being and safety. We hope that other community groups of people who use drugs will be inspired and engage in meaningful and feasible research efforts. Please, next. An observational prospective cohort study was performed by recruiting participants in the implementation of the Stop Overdose Safely SOS project as a part of the broader SOS initiative launched by UNODC and WHO in 2017. The study focused on take-home naloxone implementation in Kyrgyzstan, Kazakhstan, Tajikistan, and Ukraine. In Kyrgyzstan, GLORI Foundation Harm Reduction Network were contracted by UNODC to pilot and evaluate training in opioid overdose recognition and response, including the use of naloxone. and supply of specially designed naloxone kits to all participants of the training. In 2020, Glory Foundation and Harm Reduction Network in Kyrgyzstan were subcontracted by Input for the conduct of rapid qualitative assessment of values and preferences of HCV self-testing among people who use drugs in Bishkek and Chuy region, and then by Foundation for Innovative New Diagnostics to study acceptability and feasibility of HCV self-testing among people who use drugs, where HCV prevalence is more than 60%. Please, next. During the implementation phase of the SOS project, the intervention was rolled out in Kyrgyzstan as well as in other 3 countries, with a target of training 4,000 potential witnesses of opioid overdose using the SOS package and distributing SOS naloxone kits to those potential witnesses. 50 prepared trainers in each project country, including peer trainers, trained then no less than 80 people likely to witness an overdose in individual and group settings in order to reach the target of 4,000, producing a total of around 16,000 trained across the 4 project countries. Please, next. Key parameters of the implementation of the SOS project across the implementation phase were collected by research partners in each country and sent to the leading group comprised of the principal investigator from the Burnett Institute in Australia and representatives from the WHO and UNODC, who compiled the process evaluation spreadsheet that was updated over time. These key parameters include the number of trainers, potential opioid overdose witnesses trained through the project, and number of naloxone kits distributed, as well as number of refill kits requested. Please, next. In addition to those 2 focus groups, participants were administered study questionnaire at the 3 time points: baseline, immediately post-training, and 6 months follow-up post-training. Please, next. One of the goals of the SOS study was to reach 90-90-90 rate, meaning that 90% of people who are at utmost risk of overdose would have received training, 90% of those trained would have been given naloxone, and 90% of those given naloxone would be carrying naloxone and have it close in hand in case of emergency. Every effort was undertaken in each country to achieve this goal. Please, next. Harm reduction network frontline staff successfully manufactured the naloxone kits using cheap and convenient cable ducts for designing safe boxes with sliding top covers for carrying naloxone. Each plastic container manufactured by people who use drugs for themselves includes the following items: 2 ampoules of naloxone, a pair of latex gloves, 2 alcohol pads, 2 syringes, and a leaflet with guidelines written by people who use drugs using their common language. Next, please. And I think we have to skip this because this is what each kit has. Project beneficiaries highly appreciated the training quality and highlighted the enhanced skills in helping people experiencing overdose. Please, next. They also mentioned increased acceptance and positive community views of people who use and inject drugs. Next, please. Participating in the project significantly increased commitment of people who use drugs to care more about their health and utilize the public health services more effectively. Next, please. And next. Thank you. While implementing the hepatitis C self-testing project, we split it into 2 parts. First, the assessment of values and preferences of hepatitis C self-testing was carried in the fall of 2020. And then in 2021, the second stage started, focused on acceptability and feasibility of HCV self-testing among people who inject drugs. It's the ongoing effort being carried to determine acceptability and preferences of HCV self-testing among population of high risk of having HCV infection, to determine the ability to correctly perform tests and interpret results using observed testing model, and to measure concordance between HCV self-testing results and results of lab-based HCV testing. Please, next. In both stages, the study participants were people who use drugs who are no younger than 18 years old. Participants in stage 1 had to hold HCV-specific experience and knowledge. useful for operational purposes. Participants in stage 2, however, were eligible if they had never been tested for HCV or tested HCV negative in the most recent test performed no later than 12 months before enrollment. Please, next. For collecting qualitative data on stage 1, we conducted individual and group semi-structured interviews as well as participatory action research exercises. Please, next. Study flow on stage 2 was pretty traditional for this type of research. The eligible participants signed consent form, performed self-test. The results were interpreted by themselves and also by medical staff blinded to self-reported results. If self-test results were positive, the participants were navigated to the lab for confirmatory HCV testing. Those tested positive at the lab were then navigated to high-quality care and treatment services, fully generously covered by the Foundation for Innovative New Diagnostics. We documented the test results and collected the data through semi-structured interviews and survey. We also encouraged participants to complete the anonymous client satisfaction survey after lab testing and in 1 month after treatment started. Please, next. People who use drugs interviewed at stage 1 demonstrated proper awareness with respect to the concept of hepatitis C self-testing, the disease origin, its nature, and the ways it gets transmitted. Their performance in terms of self-testing delivery varied from the government clinics to the private clinics, and certainly to harm reduction community-based NGOs that can even provide HCV-specific medication when it is available. Please, next. Finance issues, discrimination by medical personnel, psychological discomfort, and myths and lack of relevant information about HCV were reported as challenges that impact their peers' commitment to test for HCV. They mentioned that people living with HIV, for example, are protected by a law on AIDS that describes their rights and responsibilities. However, people with HCV do not have such opportunities, as there is no legislative framework describing what they can expect and count on and what the society would expect from them. Please, next. They mentioned that they would prefer to get tests through the outreach staff at the NGOs that they collaborate with and through vending machines installed in the trade centers. They also suggested to make them available through pharmacies and maybe even through drug dealers. Please, next. As of today, the OraQuick self-tests and professional tests were received and administered, high-quality medication procured and administered.
Daniel,
and,
1 minute.
Okay.
Impressive presentation, by the way.
Okay. And service and interviews completed. The data are being analyzed. And the last, please. Participants in both overdose prevention projects and the HCV self-test project suggested that medical professionals have to further train to minimize stigma and neglect towards people who use drugs. They are sure that efforts have to be undertaken to engage the prison management authority for developing proper testing and treatment protocols applicable for in-prison framework. The cost for testing and overdose prevention services have to be covered by the medical insurance, and key populations have to be eligible to it. And the last slide. So there are also other recommendations that can be found in the materials available through all these links. Thank you so much, Oriol, for all your support and help.
Thanks to you, Daniel. We encourage you to keep on doing this amazing work in Kyrgyzstan. Congratulations. This is a pretty good example for the goal of this side event, promoting evidence-based interventions worldwide. Thank you so much. Okay, we only have 3 minutes left, so I've decided as chair to select a very interesting comment from Riot, which is one of the co-organizers, and a question addressed to Susanna LLAV. Riot is an NGO. I will read it from Riot. This is an NGO working on drugs in Latin America, developed interventions that are always based on public health approach, respect for human rights and differential circumstances. In this sense, the drug care system in the region contains a series of weaknesses that have been exacerbated by the pandemic, with a greater impact on highly vulnerable individuals and communities. And that can only be overcome by establishing formal cooperation mechanisms between governments and international organizations with civil society. Therefore, RIOT believes that we will only achieve effective strategies and interventions built on quality standards if in the region, firstly, there is greater investment in prevention, treatment, and harm reduction mechanisms, and secondly, if the work of these mechanisms is strengthened through the establishment of care networks that allow to work connected and coordinated with other networks and educational, social, and economic resources. Thank you so much, Riot, for this comment. And then I also have a question for Susana from Ecuador, Patricio Zapata, who's asking to you, in what time of implementation can you project of prevention can a project of prevention to the use and consumption of drugs be evaluated? And if I could point out to the pretest instruments and polls used, I think he's saying how long time does it takes evaluating in such a way you were presenting. Thank you so much.
Thank you very much for the question. We are thinking about a total of 4 years with a pre-test, the implementation of the program, then a post-test, and a follow-up of 3-6 months, and then 1, 2, and 3 years follow-up. It's very important to have evaluations on the short, medium, and long-term evaluation. So it's a total of 4 years.
4
I
years.
don't know if I'm asking the question.
I think so.
Sorry,
anyway, we can keep on talking after the side event with Patricio if he wants to. Okay, some of you, precisely Jose Ángel Prado from Centros de Integración Juvenil. Hello, hola Ángel, saludo. He's asking about the slides. We will ask first to the presenters if they don't mind to send them forward to all the participants afterwards, as we have all your emails. So thank you so much. I think it's time to finish this side event. Short, you know, it's always short, but at least we are trying to witness what we do, selecting very few presentations, presenters, speakers, and supported by very important institutions today. So thank you so much. I hope to see you very soon. And let's at least see you next week in the next CND. Goodbye, everyone. Thank you so much.
Thank you.
Thank you very much. Goodbye.